Hi everyone, my name is Joe Grubaugh and I'm about to present a toy analysis on a little toy puppet here. So this is a little black lab dog. It was, get up closer, it was purchased at IKEA for approximately $5, so relatively inexpensive. You can also get the toy puppets in a variety of other animals as well. It fits on the hand just like a glove here, so pretty easy to use. The occupational therapist could utilize this in a variety of ways to help engage play development in children across a variety of aspects, cognitive, social aspects, perceptual motor, variety of areas. It's according to K. Smith and O'Brien, this would be more or less used within the play-based relationship-focused intervention, where we'd really try and engage the child in meeting the just right challenge with a lot of social and then cognitive interactive aspects of that. As far as most age appropriate, I'd say this would be appropriate for children anywhere between the ages of 2 to 11. We could have some variability based upon type of disability as far as the age is concerned, or degree of disability as well. Could be associated with either gender. I'd say we could give our little puppet dog here a masculine or more of a feminine name. Cultural associations, this could be excellent within American culture, with especially if any child's ever watched Sesame Street or the Muppets in the past, or cartoons where there've been puppets on there, so they can have a developed association with that and the fun aspect of that already. Would want to keep in mind too, as far as the Islamic religion is concerned, as far as achieving tahara, or that state of spiritual purity, where animals may possibly inhibit that, but there could be once again some flexibility with that as well. Gross motor and fine motor skills utilizing the puppet. This is where things could really get fun and really could give that interactive component and therapeutic component with utilizing that. We could have emphasize the philosophy of I do, we do, and then you do. Whereas, let's say we name our puppet Rosie, where Rosie demonstrates a skill or a particular activity, and then she demonstrates that, and then we ask the child then to do that with Rosie, and then ask the child then to show Rosie how to do that, so they could show a level of skill mastery. So we could say that Rosie could jump, and then we could ask the child to jump with us, and then the child could jump by themselves, or Rosie can touch her toes. And we could ask the child if they can touch their toes, or Rosie can clap her hands, Rosie can scratch the back of her ears, she can wipe her nose, she can rub her belly, she can do a variety of things. And then that could really try and engage the child across those more gross motor activities. Fine motor skill roles, we could actually switch roles a little bit here, and because Rosie's a dog and she has paws as opposed to fingers, and therefore lacks some of the dexterity that we humans have with fingers, we could ask then the child then to take on more of a teaching role and show Rosie how to do some of the basic skills that maybe the OT has worked on with the child in the past, such as tying shoes, or using a pencil to draw a letter, or Rosie can't comb her hair, so maybe the occupational therapist could then show Rosie how to comb hair or brush teeth as well. So a variety of aspects there we could get even across some more activities of daily living to get more fine motor skills involved. As far as cognitive, perceptual, and social emotional skills, play skills that would be involved, obviously we're going to be utilizing a lot of language. We can integrate counting with the puppet as well. Also 2 rules with games, if we do interactive play with games. Some more of the perceptual requirements that are involved with the puppet. Obviously there's going to be a lot of praxis involved, or motor planning for both gross and fine motor skills, where the child then could practice then integrating that component and learning some of those skills with mimicking the behavior of the puppet. Also to social emotional, that puppet has a great aspect of being an interactive component, imaginatively, and also to literally, with as far as trying to maybe make friends or engage in play, and proper social skills when we're engaged in play, as far as mannerisms and sharing, etc., etc. I wouldn't consider any safety precautions to be involved with the puppet here. And as far as where it falls within Piaget's stages of cognitive development, it would be once again pre-operational, and then also to the concrete operational stage. So pre-operational being more egocentric, using symbols, pictorial representations, etc., some language involved, whereas the concrete operational we could get a little bit more technical with using counting and numbers and more technical rules, trying to get out of that egocentrism to creating a sense of self, as far as that Rosie has feelings too, that would be maybe separate from the child's feelings, and trying to kind of demonstrate that as well. Parton's theory, I'd say that this falls within more of the associative play development stage, where they're really focusing on an interactive component going beyond the actual toy, but the actual interaction beyond that. I would think this would be great to adapt to a child who maybe has autism, especially trying to really enhance and focus on some of that social skill and cognitive skill development. I think that would be really fun. And I would definitely recommend this toy to use. It's inexpensive, it's dynamic, you can use it across a variety of developmental play skills, also to activities of daily living. And it would just be a fun way to kind of integrate and help engage the child in the Just Right challenge.